testosterone, sex drive, and perimenopause and menopausal women. Hi, everyone. I'm Dr. Kristi Tompkins. I am a naturopathic and functional medicine doctor. I am a women's health and hormone specialist. And today's topic is on testosterone and women's sex drive or libido. And this comes up quite a bit in probably the majority of female clients that I've worked with over the years. I've been in practice now for about 17 years, and sex drive is important. Libido is important, I would say, to most women. And for a lot of women it might start as early as the late 30s. Perimenopause is usually between the ages of 35 and 55. Menopause means your period has stopped completely for 12 months and beyond. It's not coming back. And for a lot of women, their sex drive starts to drop late 30s. I would say it's probably closer to the 40s, mid 40s, late 40s, and beyond. And what happens is, as the body's preparing for menopause, when the the menstrual cycle and the bleeding will completely stop, the estrogen levels are dropping. The progesterone levels are dropping. There's more estrogen typically in the first half of a woman's cycle during the follicular phase. Progesterone is more predominantly produced and secreted in the second half, the luteal phase. Testosterone, for the majority of women, starts to rise as the period is ending and up until ovulation. And it can continue all throughout the cycle, depending on your body, your health, your age, what else is going on, other health conditions. So for a lot of women, their libido, their sex drive is typically peaks around mid-cycle. For some women, it's a little different. It might be maybe right before their period or maybe right as the period is ending. But for most women, it's typically between days 10, 11, 12, 13, 14, 15, kind of in that window. And biologically, from a reproductive standpoint, a fertility standpoint, that's usually when a woman is more likely to conceive during ovulation. And that also happens to be when the testosterone is higher and the sex drive is higher. So it makes perfect sense. Nature is very wise. So with testosterone, one of the first things that I do with my clients, we meet. I ask a lot of questions about not just her current symptoms, but past symptoms, past medical history, past symptoms, the history of her menstrual cycle, any issues with fertility or pregnancy, or any problems with her menstrual cycle, heavy bleeding, endometriosis, skipping periods. And then other things like other conditions, hypothyroidism, which will affect your menstrual cycle, chronic stress, too much cortisol, which will affect your menstrual cycle, and all the hormones as well. And so I spend a lot of time, I ask a lot of pertinent strategic questions around whatever topic she's coming in for, whatever complaint. And if it happens to be low libido, it's not always about your hormone levels. It's not always about your testosterone levels. It could be your life. It could be the stress in your life, your job stress, relationship dynamics, interaction, your weight, how you feel about your body, your blood sugar, right? There's a million different factors that need to be considered when it comes to your libido. And so I also do testing. I do blood testing. I do a pretty thorough custom panel that looks at, a metabolic panel, an advanced lipid panel, blood cells, the reproductive hormones, the estradiol, free and total testosterone, progesterone, cortisol, full thyroid panel, and a few other markers too. So I want to get that picture of looking at the different body systems. So is it a low thyroid issue? And sometimes, or sorry, not thyroid, could be thyroid too, low testosterone. And sometimes the testosterone is low, but her libido is fantastic. And it also depends on where in the cycle are we getting the blood drawn. or the level might be super high, but her libido's low. So that's where the further questioning or the evaluation with the appointments and the visits and the interaction, where I can figure out what else is going on. One of the things that can interfere with sex drive, if it's not related to a low testosterone and the testosterone's fine or it's even kind of elevated, as I mentioned, it could be hypothyroidism, it could be chronic stress, it could be antidepressant medications, anti anxiety medications, SSRIs. Those are notorious for basically killing the libido, where it makes it non existent. Again, it could also be the what's going on in her life, her work stress, maybe stress with her kids, maybe stress with aging parents, her body image. Maybe there's a pending separation or a a verbal or emotional disconnect with her partner. And again, it doesn't always have to be, have to be in a partnership to have a high or low libido. So when it comes to supporting the libido, sex drive, one of the things that can be really helpful, if everything else has been evaluated and ruled out and maybe some additional testing, I might also do a Dutch test, which looks at the urinary collection and also potentially salivary collection of the reproductive sex steroid hormones and the metabolites, as well as cortisol, cortisone, and the metabolites as well. One of the things that can help support libido, if we're not quite going to bioidentical hormone replacement therapy, would be looking at the diet, looking at the exercise. What are you putting into your body? Because what you're putting into your body is going to determine the quality and the health of your menstrual cycle, including all your reproductive hormones, including testosterone. So if there's too much sugar, too much refined carbohydrates, too many, too much alcohol, processed foods that are just pro-inflammatory, maybe too much gluten, dairy, packaged foods, things like that, then recreational drugs, other medications, as I just mentioned, that will interfere with your gut. And our gut is the primary hub for how everything else is evolving, or how everything else plays out with regard to your health. So making sure that you're putting really good quality, nutrient rich. I love the paleo diet, the Whole30 diet, the Mediterranean diet, because it does have that really nice balance between the macronutrients, the protein, carbs, and fats, and also a nice blend of the micronutrients, the vitamins and minerals and antioxidants, and lots of fiber. And of course, lots of water as well. And so, with regard to, that's the first thing. The second would be, how are you moving your body? How are you exercising? Are you exercising? Are you, how consistently? We all go through periods in our life where maybe we don't have quite the time, or there's just too much going on, and that's okay, because that's part of life. But it's getting back into it again. It's that follow through. It's getting back to doing something consistently, and not just cardiovascular workouts, aerobic conditioning like walking, running, biking, skiing, things like that, maybe treadmill, elliptical, but also doing muscle strengthening, strengthening your muscles, using your own body resistance, using weights, using barbells, dumbbells, anything that you can do that makes your muscles stronger. And you want them to be a bit sore because you want them to get stronger. And what that does is that not only increases your overall metabolic rate, where now your energy is better, your physical energy is better, or mitochondrial function, your mitochondria are operating at an optimal level, but you're also burning fat, you're building muscle, and you start to feel more empowered physically and mentally. But what it can also do, and it also is boosting human growth hormone and thyroid, and oftentimes it's reducing excess stress, excess cortisol, excess stress, and it's balancing our entire endocrine system, not to mention our gut, our skin, our brain, cardiovascular system, immune system, everything. But it can also have a slight uplifting effect on our androgenic hormones like testosterone. And so a lot of women will notice that as they're doing more muscle strengthening, it might have a slight boosting effect on testosterone and therefore libido. So, another thing that can also help support sex drive, libido, is bioidentical testosterone replacement therapy. And I have been prescribing bioidentical hormones now for about 17 years. I learned from a doctor up in the Pacific Northwest about prescribing. And these days, there's lots of ways to get testosterone. And I'm going to refer to the bioidentical version, the plant-based version of testosterone that is usually from the soy plant. It is sent to either compounding pharmacies, retail pharmacies. In some cases, you can get DHEA, or you can get DHEA cream, which is a precursor androgenic hormone that can get metabolized into testosterone or estrogen, depending on what the body needs. Typically, testosterone is a controlled substance, so usually you need a prescription for that. If you live in the United States or North America. And with testosterone, whether it's in a topical cream form, you can get it in pellet form. The injectable kind is typically, that would be the synthetic form. I don't necessarily recommend that. I'm a big fan of bioidentical. Just because it's bioidentical and quote natural from a plant, that doesn't mean you could take as much as you want, because it works in the same way. So this can work wonderfully, miraculously for women's libido. Obviously for men too. I have prescribed testosterone for men in the past when I did work with men and women for many, many years. But a little goes a long way. And so when it comes to testosterone, a small amount of cream topically often will have an effect that will help support sex drive, orgasm. It also has a boosting effect on energy, not only physical energy, but mental clarity as well, and focus, and concentration, and drive, and productivity. It can do a lot for women. Some of the side effects or drawbacks to watch out for is aggression and anger and irritability and snapping at people, your kids, your husband, whoever, when maybe that's not part of your personality. Like you're just quick to react, you're curt with people. Facial hair, chin hair, lip hair, maybe extra body hair. Maybe your underarms start to like stink a little bit. Like you just feel more masculine. And I'd say most women don't like that. Don't like those side effects. Acne breakouts on the face, on the neck, and the chest, and the back. And in a lot of cases, hair loss. So the hair starts to come out, but yet you're having a little bit more body hair. So that's not cool. Most women don't like that. So those are the most common reactions or effects if the woman is getting too much. Pellet therapy is all the rage right now. A lot of women are getting that have come to see me, and that can work great. Or if you get too much, you've gotten too much, and now you got to let it metabolize out of your body. And sometimes too much can cause all those symptoms that I just mentioned, those reactions. And it's like fantastic libido, like you're a 16-year-old teenage boy, which is great. If you're in a partner, you've got a partner, but all these other side effects like the body hair, the acne breakouts, the facial hair, the irritability, the anger, the aggression, there's a balance here. And so making sure that you're getting the right dose for you. And with bioidentical hormones, you don't have to take these hormones. Let's say testosterone, let's use that as an example. You don't have to take them every day. Sometimes I prescribe the hormones where it's every other day, a few times a week. Maybe we cut back the dose, we cut back the amount of cream at the next refill, or maybe I just have her cut it out for a little bit and then bring it back in. Or if it's not enough, we up the dose. And This often can work beautifully with other hormones like progesterone, bioidentical estrogen, or not. It's not like if you use one, you have to use the other two. Same thing with estrogen. Just because you use estrogen doesn't mean you have to use progesterone and testosterone. And so it really is a case by case. It's a personalized approach to bioidentical hormones and every kind of treatment plan that I give my client, not just for that client, but also just as time goes on, we might modify it based on what her needs are. There are some supplements out there, nutritional, professional grade, botanical supplements, nutritional supplements that might have an effect. I've never really found them to be, I'm not going to name any names here, list any herbs, but I've never really found them to be very effective for helping support libido. They might help a little bit with energy and they might help to some degree, maybe an oral DHEA. There is a topical DHEA cream, but I would caution against that because sometimes those can also cause those side effects or reactions that I just mentioned. And if you're taking a high dose, that may help with libido, but then you might have all like 25 milligrams, 50 milligrams, 15 milligrams of DHEA orally that may cause those or not. So that's where it really becomes key or crucial to work with a seasoned, experienced doctor, healthcare professional who has been prescribing hormones, knows about women's bodies, knows about, clinically what to ask, the right test to order, how to evaluate tests versus symptoms. It really is important to talk to somebody who knows, who can be a bit more discerning to say, let's cut back. Nope, let's raise. Yep, let's bring this in, or let's have you put a pause on this for a while and then let's retest in a few months. Let's reevaluate your symptoms. And then let's look at all these other factors like the diet, the exercise, the stress management, relationship counseling, all those other things too, that you might need to integrate to boost your libido. Be sure to subscribe to this channel, like the video if this was informative and you enjoyed it. Share this with a friend or friends or family members, and we'll see you next time.